Aloha, welcome to Healthcare in Hawaii. I'm your host, Josh Greene, Senator from Kona and ER physician on the Big Island. We've been having a terrific discussion these past several weeks about the healthcare system here in our state. First, we had Beth Giesting, who's the Director of Healthcare Transformation for Governor Abercrombie, followed by Hilton Rathel, who's the Senior Executive Fancy Pants at HMSA. We enjoyed Hilton very much, and Beth. We were followed up last week by the Dean of the Medical School, Jairus Hedges, who gave us terrific perspective on the future of healthcare-trained physicians in our state. And today we have another expert, a good friend of mine named George Greene. George runs the Healthcare Association of Hawaii. What does this organization do? Well, I'm going to let George tell you, but I can tell you he is very, very focused on the state and health of our hospitals, which I think is one of the central pieces of our healthcare system. George, why don't you tell us a little bit about what you do?
Sure, and thanks for having me here today, Senator Greene.
You bet.
I head up the Healthcare Association of Hawaii, and we represent all of the hospitals, most of the nursing facilities, and home care and hospice organizations, and even the durable medical equipment organizations in the state of Hawaii. We've been in existence for almost 75 years, and we represent them at the state capitol and in Washington, D.C. We provide public relations for them. We also help them with their community health needs assessment and community benefits programs. And we also handle the emergency disaster preparedness program for the state. So it's a lot of advocacy work, but with the implementation of the Affordable Care Act, we've even gotten into quality as well. So that pretty much runs the gamut of our where we commit our resources.
So it's safe to say that you guys, your team, and we'll get into who's part of your team so people can understand, are really the experts on kind of the day-to-day of what goes on in the hospitals, the challenges they face. Maybe we'll ask some questions about hospitals that are changing hands, that have closed or reopened. Is that about right?
Yeah, although I tend to say that anyone who says that they're an expert in healthcare, people should do a double take when they hear that, simply because with all of the new information that is constantly coming out, the changing rules, the changing laws, the changing policies, it's really hard to be a quote-unquote expert. I think you get to the point where you gain comprehensive knowledge about healthcare, and then you always have to learn more.
Right. Well, we're lucky to have you here today because I really think that we've been focusing on kind of the physician-patient dynamic and the training of our young docs these last few weeks. But now I think people want to know what's the health of their hospital? Are they going to worry about the hospital in their region being here tomorrow? And also the scope of your expertise, especially with the Affordable Care Act. Maybe we'll be able to get into that a little bit. Why don't you tell us a little bit about just the makeup of your team very briefly so I can understand?
Sure. We're a small staff, and we have a total of 17 people that are on Team HAH. A portion of them are grant funded, and that is strictly dedicated to emergency preparedness, and that is taking federal guidelines and really working with healthcare providers across the state to make sure that should we have a volcano erupt, should we have a tsunami come through, should we have a hurricane, that healthcare providers are prepared and know how to deal with not only their patient population, the communities they serve, and also their workforce. We also have a director of quality who works with all of the providers of the continuum of care, so looking at hospitals all the way to hospice or end-of-life care and helping them to meet the quality guidelines that are issued not only by the state but by the federal government. Then we have a vice president and chief of operations that works specifically with our post-acute care providers. And her name is Rachel Wong.
And what does post-acute care mean?
So post-acute care is any patient, the care that is necessary to them and provided by organizations after they leave the hospital setting. So it would be like a nursing facility. It would be like a home care organization that would come to your actual home and help provide you with health care. And then also hospice care, so when it's end-of-life care.
And this is becoming more important than ever, isn't it? Because we know that the Affordable Care Act has really been focusing on, number one, hospitals keeping stays to an appropriate length. They're going to be much more strict about hospital readmissions, meaning when I guess people get sick, get well in the hospital, they don't want them coming back into the hospital too quickly. So is that what your person will be working on?
Absolutely, and we call that transitions of care. And one of the focuses of our vice president is on improving those transitions of care for all the reasons that you mentioned. Because with the implementation of the Affordable Care Act, when you see patients who are discharged from a hospital If they return to the hospital and it's deemed that they return due to an illness or a condition that should have been treated originally, hospitals will actually be penalized as a result of those people coming back into the hospital setting. So we're really unique here in Hawaii because in most states across the country, the the organization that represents hospitals is different and distinct from the organization that represents nursing facilities, which is distinct from the organization that represents hospice and home health and on down the line. We are one of only 3 states in the country where the association, the Healthcare Association of Hawaii, represents that entire continuum of care, and we think that it puts us in a beneficial position with the implementation of the Affordable Care Act, because although there are different rules that apply to the different types of providers, at least we have leaders from across that continuum of care sitting around the table to talk about how we improve health care for patients as they move from hospital to nursing facility to rehab to home care to hospice. And other states don't have that advantage.
Yeah, I've been to some of your meetings, and I've noticed that when you have a room filled with the hospital executives, you really have all of them. You have the guys that are running Queens and Hawaii Pacific Health, and you have people running the nursing homes and the hospice facilities, which I suppose that makes it a lot easier to kind of cut down on wasting tests, to cut down on inefficiencies, and really, I guess we're lucky in Hawaii in some ways to be a small family kind of state to get all those services
Absolutely.
together.
I mean, you do have, for lack of a better term, economies of scale when you're dealing with that sort of membership, because the issues that face a large acute care hospital are much different than those issues that face a home health organization. But when we are in groups working together, we learn about those issues and we actually find ways to help each other out.
Let's take a step back. So tell us, George, how healthy are our hospitals? Is our hospital system solid, or do we have things to worry about?
Well, I think overall the health of our hospital system here in the state is, I would say, above average. Number one, because we collaborate. And in any business environment, you're going to have some competition.
Right.
Because at the end of the day, market share is what's going to drive revenues. But I will say, from my experience here in Hawaii, all of the hospitals, no matter the competition between them, they collaborate when the patients of this state need their help. One great example of this is when we had the closures of HMC East and West.
Yes.
When those hospitals closed, there were approximately 20 to 30 patients who were having a very difficult time being placed. And that was because either their insurance coverage had run out or they had very complex conditions.
Yes.
Well, every single hospital in the state stepped up to make sure that they took at least one, in many cases 2, 3, 4 of those remaining patients. And you don't see that in other states and other communities. So I think that contributes to the health of our hospital system. When those hospitals closed, currently we don't have an acute care facility on West Oahu.
Right.
But other facilities, whether it's Kaiser, whether it's Polymony, whether it's Queens, whether it's Castle, they've all stepped up to say we are going to absorb, even though it causes additional stress on their facilities and their operations, they've stepped up to absorb the additional patient volume that has come as a result of those hospitals closing.
Let me ask you this. Now, I know it has been very difficult on the very local community around HMC West when they closed in an ensuing year. But aside from that local difficulty, have we been able to take care of the patients from that region?
Yeah, I think that when you look at the response from those same hospitals that I've mentioned, let's be honest here, some of those patients have had a longer commute as a result, in order to receive the care that they need. But all of those facilities have definitely stepped up to make sure that those patients at the end of the day are receiving care.
Sure, that was a very good example, and I was hoping we might get to that, because if I'm not mistaken, some individual hospitals probably lost money by virtue of the closure and having to take additional patients that they hadn't seen before or didn't know before. But kind of in the spirit of community here in the state, they did all step up. And is that your general experience with the hospital executives and the teams there?
It is. we meet with the acute care CEOs of all the hospitals in the state monthly. We do the same thing with the administrators from the nursing facilities, home health, and hospice organizations. And when we sit around the table with those leaders, besides helping to focus the organization's resources, what we talk about is how can we collaborate. And I know one of the things that you'll probably want to talk about today is our community health needs assessment, but that's another area where we've collaborated and we're very unique here in Hawaii.
For certain. Tell me this, I think a lot of our viewers might be interested in knowing, since we have you as an expert, why did HMC West close? What's your feeling about that?
Sure. I think a lot of it had to do with the payer mix. So,
what does that mean, payer mix?
So the payer mix is the different sources of income to fund the operations of any given hospital. And with those facilities, there was a very high percentage of Medicaid patient that presented at those facilities. And when you look at the different types of payers, you have commercial insurance, which is HMSA, as an example. Then you have Medicare, which is the federal government, Washington, D.C. Then you have Medicaid, which is the state of Hawaii. And when you look at those three payers, the payer that reimburses the least is Medicaid. And when you look at us as compared to the rest of the country, right now we're receiving about 85% of cost with regard to that sort of reimbursement. I think that played a major role in those facilities closing.
Yeah, it was my understanding that the quote-unquote payer mix of Medicare and Medicaid was about 70% at HMC West, and so the nuns who had done a wonderful job preserving that safety net service there with the hospital for so many years, just one year after another, they were going to lose money. And after a certain amount of time, the strain was simply too great and they couldn't stay open. But let me ask a quick question before we go to our first break. I spent a lot of time talking about HHSC, which is Hawaii Health System Corporation. You represent them as well, right?
Yes.
So it's my understanding that they also have a similar payer mix. They're the neighbor island hospitals for the most part, and I think that they have a payer mix of 65% or so of Medicare, Medicaid. Are they in the same straits? Do they have the same challenges?
They do have the same challenges. I think one of the differences in between the state hospital system and HMC East and West is that as state facilities, they receive a subsidy from the state of Hawaii, which helps them to balance out that payer mix. And frankly, without that subsidy, I don't know that they would close, but they might have to lessen the amount of services that they're providing, that's for sure.
That's interesting. So yeah, my understanding is it's about 10% of the budget for HHSC is, it's tax dollars, right? It's a state subsidy, and that's somewhere around $80 million a year.
So, yeah, it's around $80 million a year.
So yeah, and I'm not here to judge today. That's one of the kind of enduring questions that I'm sure we'll continue to come back to over the course of these many weeks, and that is that the right investment for the taxpayer? I sure know that my neighbor island community is very appreciative of having Kona Hospital and Hilo Hospital and Kohala and Ka'u, but it does, it is one of those important questions.
It is. It is.
Okay, well, thank you again so much for being with us.
Absolutely.
We're going to take a brief break, and then we're going to come back with George Greene from the Healthcare Association of Hawaii and talk about this, the State of Hawaii Community Health Needs Assessment.
Aloha, I'm Nicole Horry for ThinkTech. For nearly half a century, the Hawaii Foreign Trade Zone No. 9 has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBET, the Department of Business, Economic Development, and Tourism, operates Hawaii's Foreign Trade Zone program to encourage international business and economic development. The Foreign Trade Zone's mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Nicole Horry. Mahalo.
Welcome back to Healthcare in Hawaii. I'm your host, Josh Greene, Senator from Kona. Today I have George Greene, my younger brother, who is from the Healthcare Association of Hawaii. In our first segment, we were able to discuss some of the state of the hospital system here in Hawaii. We were talking about HMC West. We were talking about why that hospital closed, and also what the overall scope of the Healthcare Association is, all the advocacy work they do on behalf of the people of Hawaii to keep our hospitals healthy and open. But they don't just focus on the hospitals and the long-term care facilities and the hospice facilities alone. They also do some really groundbreaking research and assessment of the whole healthcare system. Today I held up earlier, this is just a copy of the report. It's nice and shiny otherwise, but this is the State of Hawaii Community Health Needs Assessment. And George Greene was the gentleman who brought this thing together. Refer to him as my younger brother, but really he's much older than me. So George is a good friend, and I wanted him to give us kind of an overview of what this needs assessment is, and why did we do this? Why did the Healthcare Association do this project?
Sure. A couple of things, Josh, and again, I appreciate the opportunity to inform people about the Community Health Needs Assessment. This was a mandate of the Affordable Care Act. So when that law was passed, one of the sections of the law required all acute care facilities, all private acute care facilities, to every 3 years conduct a community health needs assessment of the patient population that it served. And every 3 years, they are going to be required to renew that community health needs assessment. Mm-hmm. The idea behind this is that all hospitals have what they call community benefits programs. Those are low and no cost programs that are provided to the community to try and improve public health. It might be cancer screening, it might be diabetes screening, it might be obesity education, it might be nutrition education. Mm-hmm. And the idea is that once you conduct this community health needs assessment, you will know exactly what are the top health issues for the community that you serve. And then you can take your community benefits program and direct them towards improving those identified health issues for your community. Mm-hmm. The unique thing that we've done here in Hawaii, and we're one of only 2 states to do this, being very groundbreaking here, is that instead of, per the letter of the law, each individual hospital in the state conducting its own community health needs assessment, all of the hospitals in the state of Hawaii came together and said, let's do this as a group. Let's take a look at what are the most prevalent statewide health issues that we're facing, and then we'll break it down for each of our individual communities. So what this means is that every 3 years, these hospitals and key stakeholders in the community, so we've brought the Heart Foundation, the Kidney Foundation, the Cancer Foundation to the table to say, these are the issues that have been identified. Mm-hmm. How can we take our combined resources and work on them to the benefit of these communities? And in turn, how can we make an impact across the entire state of Hawaii?
So basically this becomes a snapshot of the entire state of Hawaii's healthcare system. Is that right?
Yes.
And all of these partners, they collaborated as equals? Is that how it went?
Well, it was led by the hospitals because they were the ones that had the mandate. And, I have to give kudos to HHSC because as a public entity, the law did not require them to do this community health needs assessment. But because they are so invested in the health of the communities that they're serving, mm-hmm. they decided to step up and take part in this community health needs assessment. And so it was driven by the hospitals,
right?
But as we had this dialogue, we realized, mental health, obesity, diabetes, chronic heart failure, as these issues presented themselves via the research and the interviews and the data, we realized there are other organizations out there that are targeting these same health issues. So why not bring them to the table so that we could figure out the synergistic ways we could work together.
Got it. So okay, well, let's dive into this report. I know we only have a few minutes here today,
Sure.
But why don't you tell us the highlights? What came from this assessment? What are the bigger health problems that we've got that you've isolated?
Well, I think some of them are what if you're in the healthcare arena, what you have either tangentially known or just through where your primary focus is in providing health care, mm-hmm. you've known our issues here in Hawaii. We have issues with obesity. We have issues with diabetes. We have issues with asthma. We have issues with chronic heart conditions.
Right.
One of the ones that really jumped out to us as a group was behavioral health issues.
Break that down for us. When you say behavioral health, does that mean serious mental illness? What does that mean?
It's a combination of mental illness, substance abuse. Really, those are the primary drivers.
So methamphetamine, schizophrenia, depression.
Yes.
Okay, so that jumped out. So you said that we knew that we had problems with obesity. We know we have disparities that in different parts of our communities we have much higher rates of obesity. I know that in this report, the Hawaiian community has suffered a disproportionate amount of cardiovascular disease, that's heart disease and lung disease. But you found that mental illness and behavioral health is a big issue. How big an issue is it? Are we really missing it?
I think that we are, and I think there's a lot of work to be done, because if you look at the trends, and we're looking at, again, hospital-based data. If you look at the admits and the discharges related to behavioral health and mental health issues, it's on an upward tick, or it's becoming greater. And when you look at this issue, as we've dug into it, we've realized that we need to have more community-based services in place to support this patient population. We also realize that we need to have better transitions when these patients are discharged from facilities, to not only help them find proper services in the community, but to make sure that they are attending their follow-up appointments, to make sure that they are taking their prescriptions, because helping them manage the illness, or helping them manage the addiction, will prevent them from ending up back in the hospital, because these aren't patients that want to be in the hospital.
Yeah.
And so it's better to manage this in the community, but we found that the community services are lacking right now across the state, and it's more disparate on the neighbor islands.
Well, like you said, I think though it seems intuitive now to hear it, I can tell you a little vignette. Once when I was working on a shift, I'm in the ER shift again tomorrow, right? But when I was in the ER shift back in about 2004, 2005, I got a call from the local medics, and they did ask me to do something very rare, which was, they said, could you come out of the hospital and come up the street? We need you to see a patient. And I thought, well, they never asked me to do this before, so what are they talking about? But it's a different environment here in the state of Hawaii, so I jumped into my Jeep and I rode up the street a half mile, and there was a young woman, 20 years old, and she was holding onto a fence. And she was holding onto this fence, and her eyes were closed. She was gripping it so tight, they couldn't get her off of the fence. And they immediately described to me what her problems were. She had schizophrenia or psychotic illness, and she also had a severe methamphetamine addiction. And she was basically in a state of almost catatonia, holding onto the fence, because she had had no services whatsoever. In order to get her care in our little hospital, the HHSC hospital as you described, which we're keeping open with state funds, thank God, we actually had to cut the fence around her and take her and this fence from the school district down to the ER, where gradually we were able to give her some medicine to calm down, begin the process of getting her into rehabilitation, begin the process of treating her many other complex health problems. And that was one example of how severe some of the behavioral health problems are. And we probably could have taken much better care of that young woman had she been in counseling, had we had some outpatient drug rehabilitation services for her. So is that what you're talking about?
Yeah. I mean, it is a comprehensive treatment that is lacking. And it speaks to a lack of community services. It speaks to really what I think this study, this report helps us do, and that is draw a line in the sand and figure out what are the priorities where we need to focus not only the resources of the hospitals, but the community stakeholders, but even at the state level. And so I think what it hopefully will allow us to do is to join hands around these priority health issues, these gaps in providing care, and focus all of our resources towards them. And it's going to take time, but the idea is that every 3 years to see that public health needle moving forward.
Right.
And really it's been our vision at the Healthcare Association, and that's really why we wanted to bring all of the hospitals together, all of the community stakeholders. I have to really give a nod to the Department of Health, because they wanted to be part of this process and have dedicated some of their resources to this as well. But when we hit that 9-year mark, 12-year mark, and we look back at 2013,
Right.
hopefully we will see a mitigation in all of these issues that have been identified in 2013, and we'll know that we've made a lot of progress.
So you're saying that 3 years out, 6 years out, 9 years out, we'll be able to say, okay, our obesity rate in the community was this in 2013, but it's been steadily dropping, or diabetes numbers have gotten worse.
Right.
And am I correct in assuming that this can be a policy driver, that the information in this report can inform not just legislators, but the private sector, investors, the hospital community in general? Okay, maybe we don't need as many beds for severe cancer treatment. Maybe we need more beds to deal with people who have schizophrenia and these other behavioral health issues.
Right. I think you hit the nail on the head. I mean, the thing about it is, being that this is a federal guideline, it could be a carrot or a stick.
Yes.
Because if you identify priorities in your community, in your state, and you're not improving them over time, remember, this is designed for private facilities who have a not-for-profit status.
Right.
Then it won't look good for those facilities. And I think it's again a recognition of that by our hospitals here in this state, that if this is a tool that we can use and use to the benefit of the communities that we're serving, we want to get together and do it. And they're taking great first steps.
So this is the kind of report that, though it will help us with our policy decisions and help us with the right investment decisions in our healthcare system, it could also hold us to account. In other words, we drop the ball and we see even more untreated behavioral health issues, or we see even worse obesity issues. People are going to say, Hawaii, what are you doing, for gosh sakes? Why haven't you stepped up and solved this problem?
Right.
Okay, well, I think that's a pretty good place for us to take our next break. When we come back, I'd like to begin talking a little bit about the Affordable Care Act, and hopefully we'll take up some of the initiatives that George and his associates at the HAH have been able to succeed in the past couple years.
Aloha, my name is Dan Bauer and I'm the General Manager of the Plaza Club. The Plaza Club is Honolulu's premier business club. We're located in the heart of the financial district on historic Fort Street Mall. On the 20th and 21st floors atop the Pioneer Plaza, our commanding skyline views, along with our award-winning cuisine and service, are known as the place to do business downtown. We offer professional as well as social events and programs to our members and their guests, all tailored to enrich their professional and personal lives and to give them the cutting edge that they deserve in business. Why don't you consider becoming a member of the club? Call me at 531-7788 or come see me and let's talk business and how the Plaza Club can work for you. Again, my name is Dan Bauer. I'm the General Manager of the club, and I'm here for you.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Greene. Today I have with me George Greene of the Healthcare Association of Hawaii. In our first segment, we were able to explore the health of our hospital system, an issue we might get into a little bit more. We talked about the Healthcare Association in general, how they care for and act as advocates and experts for the acute care hospitals, the long-term care facilities, hospice facilities, really the whole milieu of healthcare facilities in the state of Hawaii. Then we turned our attention to an interesting thing that they've done, which was create the State of Hawaii Community Health Needs Assessment. This document, which they're going to be producing every 3 years, is going to be a very valuable policy-driven document for us. It tells us where we are on issues like obesity, diabetes, asthma, behavioral health issues, and may help us to decide best how to invest our resources and time to make our healthcare system very solid in the state of Hawaii. But that's not all they do. George and his partners over at the Healthcare Association have also worked on some very large projects in the state politically. I thought maybe we would address one that has come up over the years, the Healthcare Sustainability Act. Could you tell us a little bit about that, George, and why those were important?
Sure. And before I get into the details of the sustainability programs, I would be remiss not to say thank you to you, Senator Greene, because you played a key role in helping us introduce and get that legislation passed and signed into law. And as I hope your audience hears in a moment, it's very important for the healthcare providers in the state, specifically acute care and long-term care providers across the state of Hawaii.
So what does that bill do? I mean, you guys really led the way, because it was my understanding going into that dialogue that we were one of the only states that wasn't doing it. So, well, what is this? What is this healthcare sustainability business?
It's essentially a federal program, and the intention of this federal program is to recognize the care that's provided to the Medicaid population. If you recall earlier in our conversation, when we were talking about the different types of reimbursement for healthcare providers,
right.
There was commercial insurance, there was Medicare, and then there was Medicaid. Medicaid provides the least amount of reimbursement for those who have that sort of insurance. And in our state, prior to enacting the sustainability programs, when you look at the amount it costs for a hospital, let's say to treat a broken leg, and just for argument's sake, let's say it costs that hospital $1,000 to fix a broken leg.
Right.
If you look at the commercial insurance patient, that hospital may receive a cost for it, $1,000, maybe a little more. When you look at Medicare, probably around $850 to $900 for that $1,000 in cost. Prior to this program being in place, someone who's covered by Medicaid, that insurance would only reimburse the hospital $700, even though it costs that hospital $1,000.
And to give people perspective, 295,000 individuals have a Quest insurance or Medicaid in our state. So we're very committed. We've made that decision as a society to take care of everyone, make sure everyone has coverage. But because funding is only so much, you're saying basically that it ends up paying less than the actual provision of the services cost at the hospital. So they're losing money.
Correct. Hospitals lose money, nursing facilities lose money on every Medicaid patient that comes into their facility.
So how does that tie into this Sustainability Act? What's the connection there?
So what the federal program allows, it essentially allows an industry to tax itself.
Okay.
And so nothing comes from the taxpayers of Hawaii, nothing comes from, no funds come from the state of Hawaii. But this federal program allows an industry, whether it's hospitals or nursing facilities, to tax themselves,
Right.
and the state actually carries out that tax assessment. And then those tax funds are sent into the federal government. And every state in the country has what they call a federal matching rate.
Okay.
Our federal matching rate is essentially 1-to-1, meaning that anytime the state of Hawaii sends $1 to the federal government for any of the programs that allow this, we get $1 back.
Plus our dollar?
Plus our dollar.
Okay.
So you put $1 up, get $2 back.
Okay, I like this deal.
And so
Yeah.
I like the deal too, but there are some states that when they put $1 up, they get $3 back, $4 back.
Whoa.
Yeah, and it's a very complicated formula that has to do with everything from the cost of living. We have a high cost of living here,
Right.
things called the area wage index, but there are lots of variables that go into that. But for here in Hawaii, $1 up, $1 back. So our hospitals and our nursing facilities realized that the state at that time had some pretty serious budget deficits, and they didn't want to go to the state and continually ask for more and more. So they decided to utilize this federal program. They taxed themselves, and as a result of this, instead of now receiving $700 for that broken leg that costs the hospital $1,000, they're receiving approximately $850. Now, they're still losing, but it is better to lose $15 than to lose $30.
Let me get the big picture on this thing. So the hospitals, they all came together, and the long-term care facilities came together. So you put this HUI together, you work through the details, and how much did the facilities tax themselves per year? About how much money did they
So on the
collect?
hospital side, it's approximately $29 million.
Okay, and the long-term care?
Long-term care is approximately $9 million.
Okay, so that you said 27 and 9. So that $36 million, they collected, they sent it to the feds because of this law that we passed together, and then it comes back double.
Double. Yeah.
Okay. And that helped to provide more services, keep hospitals open. What did it do?
All of that, Senator Greene. Keep hospitals open, continue to provide access to care, in some cases provide new services, in some cases reinvest in their organizations in areas where they're deficient, whether it be workforce, whether it be infrastructure. And I would say that when you look at the closures of HMC East and West, because they had high Medicaid populations, the fact that we had a sustainability program in all likelihood went into the decision-making process of Queens in this case in deciding to open that hospital on the West because they knew that they would have a high Medicaid population and this program would help them.
That might be similar, am I correct, to the hospital situation on Big Island? Queens is now in negotiations, I understand. I've spoken with Art Ushijima and others. I don't think it's a big secret. They're partnering in some way or other with North Hawaii Community Hospital. They also have had a very high Medicaid rate of individuals. I think it's almost 50% on the Big Island. So you're saying that this act that we've passed, this Sustainability Act, that could continue to bring in money from the federal government for those facilities?
Absolutely, and it does have a positive impact for North Hawaii Community Hospital, and I think it's important to note that we've been very conservative with this program. And we've been conservative because at the federal level there have been discussions of utilizing this federal program to reduce their budget deficits.
Oh boy.
And so what we decided to do is come in at a safe level that would help hospitals, help nursing facilities, but that in the event that the feds decided to reduce this program, we would still be able to reap benefits from it. And we're confident that moving forward, we will be able to continue to reap benefits. And at the end of the day, although it helps the reimbursement of nursing facilities and hospitals, it means that they're going to provide better care to the patients and the communities around this state, and be able to reinvest in those organizations to give better patient care.
Gotcha. And I think, I know you told me on many occasions you had other partners in passing of that bill. I mean, I played a very small role, but I know that you work closely with Pat McManaman, the head of Department of Human Services, the governor, and we're able to work out ways to bring extra resources to the administration as well. Is that?
Yeah, absolutely. I mean, we view this as a win-win for everyone. We had a fantastic partnership with the Department of Human Services and Director McManaman, also with Governor Abercrombie. They were instrumental in bringing this program across the finish line, as it were, in making sure that it was signed into law in a way that would benefit not only the state, but also the private facilities for the communities around the islands.
Well, I give you guys credit because I think all three of you came in a little after me, and in those years before, while other states were doing this program, we hadn't gotten our act together. So with the three of you coming and bringing your leadership to the table, now we join the rest of the states in our country, and we're seeing some of those resources for our hospitals. I know for a fact that my constituents on the Big Island are very grateful that they didn't see a hospital close. That would be, a catastrophic event. So thank you for that.
Oh well, you're welcome. I mean, it's this is part and parcel to the mission of the Healthcare Association of Hawaii. We want improved access, we want quality care, and we want collaboration across the state. And we believe that that all the healthcare providers in this state are very judicious in the way that they run their organizations. And as such, we think that the reimbursement should match the way that they provide high quality care and continue to provide access for all populations, and specifically for the Medicaid population. When we saw this as an opportunity to improve reimbursement for taking care of those individuals, we knew it was something that we wanted to pursue, and a lot of people came together and worked collaboratively to make sure that this happened.
Excellent. We're going to go into our final break, and then when we come back, we're going to ask George Greene what he thinks the challenges that lie ahead are for our hospital system and the whole healthcare system in general, and then we'll wrap up today's excellent program. Thank you for joining us here on Healthcare in Hawaii. I'm Josh Greene, your host.
Aloha, this is Jay Fidel. ThinkTech and the Hawaii Venture Capital Association put on monthly luncheon panel programs at the Plaza Club here in Pioneer Plaza. Our program this time is on September 26th. It's called Solar in Hawaii. We're going to examine the solar industry and see what's in it for the long haul. We have a great panel, great moderator. We'll be sending out email on this. If you want to be in our email list to receive the details, check out thinktechhawaii.com. In any event, you can sign up for the program at hvca.org. Thanks. See you there. This is Jay Fidel. Mahalo.
Welcome back to Healthcare in Hawaii. I'm your host, Josh Greene, Senator from Kona. Today I have George Greene, the head of the Healthcare Association of Hawaii, as my guest. We've had a terrific discussion so far today, talking about the mission of the Healthcare Association, how it focuses as an advocate and expert in bringing data together, and really the key challenges of our day for our hospitals, our long-term care facilities, our hospice facilities, really the whole gamut of healthcare facilities in our state. We've talked about the impact of Medicaid and Medicare. We've talked about a little bit the Affordable Care Act. We've really gone into great depth about what they do. But now, since we have George here with us today and he has such a broad perspective on healthcare for our state, I really would like to ask him, what does he think the challenges are going to be for our hospital and healthcare system in the next 10 years? George?
Well, thanks for the opportunity again, Senator Greene. It's been a pleasure being here today. With regard to the challenges over the next decade, one of the first things that comes to mind to me is how we're going to provide care for our rapidly aging population here. When you look at all of the statistics, Hawaii has the fastest aging population in the entire country. So those skilled nursing or nursing facility beds are going to be ever more important. When you look at the ability to provide home care, it's going to be more and more important, because one thing we know here in our state is that people want to receive care at home.
Right.
And so we need to make sure that we have high quality home care organizations that have the support to take care of people in their homes. And so I think that's a huge issue for us.
It was once brought to my attention, I think by your predecessor, that the long-term care challenge that we have in the state of Hawaii, where many times or many days during the year we don't have enough long-term care beds in the right parts of our state to house those individuals that have left the hospital from their heart attack or their pneumonia or whatever health problem they've had to go into long-term care, that it puts a financial strain on the hospitals, and that is where we tend to lose most of our money. Right. Really that could threaten some of the hospital system. Could you elaborate on that a little bit? Do we have to build more long-term care beds? What do we have to do?
I think you're talking about the wait list issue.
Yes.
The big issue with the wait list is these are patients who are ready to be discharged from a hospital, and they can't find either an appropriate post-acute care, so nursing facility, rehab bed for them, or their insurance has run out, and these facilities know that they're going to lose money on these patients, and the hospital decides that it's better to keep them in the acute care setting.
Got it.
So what ends up happening is that you have a patient who is in an acute care hospital bed,
Like Queens,
okay. Kapiolani,
Right.
Palimomi, Castle, and they should be receiving a much lesser acuity of care. So when I say acuity,
they don't need as much care.
They don't need as much care as a hospital can provide.
Right.
Yet the costs, as you would imagine, the costs of keeping a hospital open are much different than keeping a nursing facility open.
Okay.
So, and at that point, once this patient is no longer deemed to need hospital care, the rate of reimbursement or pay for that hospital drops. So they're losing even more money on this patient, and there's not a long-term care nursing facility bed available for this patient.
So does that mean we solve this problem? Do we build more long-term care beds? Do we have more outpatient care like the Affordable Care Act, Obamacare has discussed? What do we do to solve that problem?
I think it's a combination of those solutions. I think you do have to have more home-based care. I think you do have to have nursing facilities that can take care of more complex patients. But then I think you also have to take a look at changing the reimbursement system for these patients. One of the pieces of legislation that has been discussed has been looking at what they call a wait list reimbursement. It's not reimbursement at the level of for a patient who needs full hospital care, but it also isn't as low as reimbursement for a patient who's in a nursing home, somewhere in between.
Right.
And then just working on trying to put those appropriate, or increasing the number of appropriate beds in the communities would help this situation.
It seems a little ironic to me that we don't solve that problem kind of post-haste, because it's pretty much my understanding we're going to take care of everybody in the state. We're that kind of state. We're surely not perfect, and it's sometimes a challenge if you're in the neighbor islands to find a provider or a specialist, but we're going to take care of everybody if at all possible. So whether the money's there or not, based on these reimbursement models, if someone gets stuck in the hospital, the bed isn't right, and the hospital loses money, I'm pretty certain the taxpayers end up paying for the subsidy anyway. So one way or another, we're paying for it. So
Yeah.
I guess we just have to find a better, more efficient solution.
Agreed.
What else do you see in our last few minutes together, George, as challenges for the state of Hawaii? You talked about the aging population and the impact it will have on our facilities. Are we going to see another hospital close?
I don't think that we'll see any hospital closures. I think you could see hospitals consolidate,
Okay.
so they may share services. Given the dialogue that occurred last year about the privatization of the state hospital system,
Right.
I think that dialogue will continue. And where does that go? I don't think anyone knows.
Right.
I do think that given the subsidy that we discussed earlier, there's a desire to either decrease that subsidy or see it go away, and whether it is one of the local private organizations or
You mean like
organization-
Queens,
or
Hawaii Pacific Health?
Pacific Health, or another organization from the mainland, I think that that's a dialogue that's going to continue. I think that a big issue for us in the coming years is going to be our aging workforce. You have been a champion for trying to not only bring in but retain physicians in our state, specifically for the neighbor islands where the problem is more acute. But I think as you look out over the workforce, there are many nurses who have come back into the workforce as a result of a declining economy. And I think that as the economy improves, which it is,
Yes.
and I think just by the sheer aging of that population, we're going to have a need for more nurses. We're going to have a need for more lab techs, rad techs, PAs, nursing assistants. And I think that that is an issue that we have to address on a statewide basis, because the cost of living here is high.
Yeah.
And one of the things that I hear from not only our team at HAH, but many of our members, is that a lot of their kids will go to the mainland for college, and then they find it hard to come back here because of that cost of living. We're going to have the jobs, but we're going to have to work creatively to make sure that we can support those who want to come back and work in the healthcare industry. So that's another issue that I think we'll be facing.
Okay, so we've got long-term care, the aging population, and the healthcare workforce. And I think that's a very good place for us to begin to wrap up, because those seem to be fundamental questions. I think that it does, for those who are viewing our program today, speak to the opportunities in healthcare. Certainly, as a society, we know we're going to need healthcare workers and investment. These are some of the best jobs, and it takes time to get trained up to do these jobs. But I want to encourage young people out there. I want to encourage our high school students and our youngsters that are going to community college and our four-year programs. Consider healthcare opportunities, because we're going to need you in the long-term care facilities and in the hospitals and in the trenches of healthcare.
Absolutely, and it's great work. It's rewarding work at the end of the day, and it's really one of the reasons that I got into healthcare and fell in love with it. My background's as a lawyer, and I had the opportunity to work in healthcare, and in very short order, I realized that at the end of the day, if you're in healthcare, if you're doing your job well, you're helping improve patient care, and people are getting healthier. So it's a fantastic area to work in.
Well, George, thank you for being with us here today. We're glad your expertise brought you to Hawaii. It's been really a blessing to have you at the Healthcare Association of Hawaii. And I would single out also this effort that you did with the Community Health Needs Assessment. I think this is going to be a very significant piece of work that's going to drive our healthcare policy decisions, and we appreciate that. So thanks for being here today.
Thank
with
you,
us.
Senator Greene.
You bet. So we come to the end of our segment for this week in Healthcare in Hawaii. We thank George Greene, the Director of the Healthcare Association of Hawaii, for his expert comments on our healthcare system. My apologies, next week I'm stuck in the emergency department on duty for 48 hours, so I won't be with you, but we will be broadcasting one of our previous 4 programs. Then I'll join you again a week later with our next guest. Thank you again for joining us here for an hour at Healthcare in Hawaii. I'm your host, Josh Greene.